strain on medical facilities could result in inadequate care for both infectious and non-infectious conditions. Public health challenges. The erosion of trust in health agencies and the spread of misinformation may hinder effective public health responses. Would you like to delve deeper into any of these aspects or proceed to the next sign?
Let's see. Is there stuff about the Black Plague? Is there anything talking about that? I mean, it's been around. Isn't there anything about the Black Plague resurfacing? It's still around. Rats hold it, and now, I mean, with all the stuff that Trump's doing, we could see a resurgence of that, and that kills quick. Can you tell us about the Black Plague? You know, the Black Plague is still around, folks. Right, you understand that. It hasn't gone away.
Bubonic plague, Black Death.
Yeah.
Overview. Historical context. The Black Death, a devastating pandemic in the 14th century caused by the bacterium Yersinia pestis, transmitted primarily through fleas on rats. It resulted in the deaths of millions across Europe and Asia. Current status, ongoing presence. The plague still exists today, with occasional cases reported globally.
That's right.
In recent decades, the United States has seen an average of 7 human plague cases annually, primarily the bubonic form. Transmission and symptoms. Transmission, primarily through flea bites from infected rodents, but can also spread through respiratory droplets in the case of pneumonic plague. Symptoms, sudden fever, chills, swollen and tender lymph nodes, buboes, headache, and fatigue. Treatment and prognosis. Antibiotics, effective if administered promptly. Delays can lead to severe complications or death. Public health concerns. Antibiotic resistance. Emergence of resistant strains poses a significant threat. Recent cases in Madagascar and Peru have highlighted this risk. Healthcare system strain. The Trump administration's cuts to the CDC and other health agencies have raised concerns about the nation's preparedness for emerging infectious diseases, including the plague. Preventive measures. Rodent control. Reducing human-rodent interactions can decrease the risk of transmission.
Yeah, but there isn't. They're
health
firing people.
Monitoring and
more
rapid
rodents,
response
more
are crucial
disease.
to prevent outbreaks. Vaccination. Development of a plague vaccine is underway, with clinical trials showing promising results. Conclusion.
He's going to kill that.
While the Black Death is not a widespread threat today,
doesn't believe in vaccines.
Its potential for resurgence exists, especially with factors like antibiotic resistance and weakened public health infrastructure. Ongoing vigilance and preparedness are essential to prevent and manage potential outbreaks.
Hey, tell us the impact of canceling U.S. aid and also the Ebola and all of the work that they were doing in regards to Africa in containing AIDS and all these other things, and why that was important, and how Trump's just firing and dismantling means that there is really no Ebola assistance right now. It's worse.
Impact of dismantling USAID on global health initiatives. Background: USAID's role. The U.S. Agency for International Development, USAID, has been instrumental in combating diseases like Ebola and AIDS in Africa. Programs such as the President's Emergency Plan for AIDS Relief, PEPFAR, have significantly reduced HIV-related deaths. Consequences of funding cuts. Program suspensions.
This is all gone.
The Trump administration's decision to cut over 90% of USAID contracts has halted critical health initiatives. This includes suspending malnutrition treatment in Congo and food assistance for over 1 million people in Ethiopia. Ebola response impact. In Uganda, an ongoing Ebola outbreak has been complicated by reduced funding, leading to concerns over disease surveillance and response effectiveness. The absence of approved vaccines for the Sudan strain of Ebola further exacerbates the situation. Healthcare system strain. Cuts to USAID have disrupted essential health services, leaving millions without access to life-saving medical care, including treatments for HIV and other infectious diseases. Global health implications. Increased disease spread. The reduction in health programs may lead to the resurgence of diseases like Ebola and AIDS, as preventive and treatment efforts are scaled back. Humanitarian crisis. The dismantling of USAID has contributed to a broader humanitarian crisis, affecting nutrition, maternal and child health, and disease prevention efforts worldwide. Conclusion. The significant cut